Hi, good morning everyone, and thank you for joining us today at our free eye care webinar for Eye Care Day 2020. My name is Dr. Khor Wei Boon. I'm a senior consultant here with the Singapore National Eye Centre, as well as head of the SNEC Eye Clinic at Sengkang General Hospital. Nice to see so many of you joining us today this morning, locally, and in fact, I think some from overseas as well. So my talk today will be about cataracts and cataract surgery, what you as a patient need to know. So very briefly during this webinar, I'll be speaking about how the eye functions, what is a cataract, what happens during cataract surgery, and how you can protect your eyes from disease and injury. So when I talk about the eye, I like to use the example of a camera, all right? And much like the camera where there is a lens in front that helps focuses light onto the sensor at the back of the camera, the eye too is a little bit like a camera. It has a lens in the front part that looks like a disc, and this helps focus light onto the nerve, the retina, which is the light sensing organ of the eye. So then, what is a cataract? Now remember, there is a lens in the eye, and in our eye, the natural lens looks a little bit like a tiny atapchi. It's very clear and transparent, and it allows light to enter the eye and to reach the retina, which is the light sensing organ of the eye. So a cataract is actually clouding of that natural lens in your eye. And as it becomes more cloudy and sometimes turns more brown, you'll find that light is blocked from entering the eye, and this is what gives rise to all the symptoms of a cataract. And you can see here a cross-section of the lens as it becomes more and more cataractous. So in the first picture, you'll see that the lens is actually very clear, but as it ages, it turns more and more brown until you can finally see how cloudy the lens can be when it becomes a cataract. What are the causes of cataracts? Well, by and large, the main reason for having a cataract is age. As we get older, almost all of us will develop a cataract to some extent. Some patients may develop cataracts at a slightly earlier age because of conditions that they have, such as diabetes, or if they're taking long-term medications, such as oral steroids. Finally, there are some very less common reasons for having a cataract, such as injury to the eye or inflammation of the eye due to other eye conditions. So what are some of the symptoms of a cataract? Well, I think the most common symptom of a cataract really is cloudy vision. Your vision becomes blurry, it's not sharp or in focus. You'll find that there's a reduction in contrast so that you have difficulty making out details, such as on signs, or even recognizing someone's face. Some patients develop what we call glare. That means things look very bright, for example, in daytime, or in nighttime, lights are not pinpoint. You may see streaks or rings around these lights. Some patients also find that their power of their glasses keeps changing, for example, every 6 months. So they make a pair of glasses and then they find that after a while, it's no longer in focus. And when they go back to the optical shop, they find that the glasses power has changed once again. A lot of the times, the change in the power makes you more short-sighted or myopic. Now, this may actually be beneficial. It can give rise to what we call a second sight. Because you're a bit short-sighted, it helps with your reading. And you may find that you no longer need reading glasses so often anymore. Unfortunately, this comes at the expense of your distance vision. Because you're short-sighted, you're no longer able to see far distance quite so well. And you may find, in fact, that you need glasses for distance vision now. I do have a lot of patients that come to seek treatment because of other symptoms. And they ask me, are these symptoms of a cataract? So for example, patients may find that their eyes are constantly irritable, itchy, painful, sharp poking pains in the eyes. They may see floaters that are lines, dots, or cobwebs moving around in their vision. Or they may find that the eye is always a little bit teary, a little bit irritable. And their worry is, are these symptoms of a cataract? So in short, fortunately, these are not symptoms of a cataract. But if you do have these problems, I would advise you to see an eye doctor or eye care professional to decide if there are other diseases that could be causing these problems. If you do have a cataract, then how do we treat or manage the cataract? Well, firstly is to decide if it is affecting your ability to work, to drive, or to do certain activities. For example, reading or hobbies, for example, using the phone, playing golf. If you find that making a new pair of glasses, changing the power of your glasses can give you better vision, then that may be all that you need at that point in time. However, if glasses don't help anymore, or you find that you have to keep changing your glasses, then you may need to consider cataract surgery. Fortunately, cataracts develop very slowly, so surgery is rarely an emergency, unless in the very rare conditions that is causing glaucoma or inflammation due to the density of the cataract. So what happens during cataract surgery? Well, as the name suggests, cataract surgery is a form of eye surgery. The cataract is removed and replaced with a man-made artificial lens implant. It's typically done in about 10 to 20 minutes under local anesthesia, and it's day surgery. Modern cataract surgery is known as phacoemulsification cataract surgery, and involves making a small incision in the cornea, that's the clear part of the eye, and inserting an ultrasound probe that will emulsify. That means it will liquefy and break up the cataract into little fragments before removing them. Once the cataract is completely removed, a new intraocular lens or artificial lens is implanted into the eye to replace the cataract that has just been removed. So at the end of the surgery, you will have a new intraocular lens in the eye to restore the vision. So what is the risk of cataract surgery? Well, cataract surgery is the most common surgery that we do here at the Singapore National Eye Centre, and it's also one of the safest surgeries that we have. Your risk is going to be less than 2 to 3%, and it does include risk of bleeding, infection, swelling of the cornea or the retina, retinal detachment, or sometimes even drooping of the eyelids. Now, some of these conditions are relatively harmless, but some are more serious. But overall, your risk of injury, and in fact, your risk of blindness is very, very rare. The benefit of cataract surgery, of course, is obvious. It does help restore vision to your eyes. Now, most patients do opt to implant a monofocal lens, which generally gives you good distance vision, but may still mean that you need reading glasses after the surgery. Fortunately, with modern special intraocular lenses, we can now have lenses that can reduce your astigmatism and even reduce presbyopia or 老花, meaning that after cataract surgery, you may find that you don't need glasses quite so much anymore, whether it's for distance or even for reading. So I'd like to end off with just a few tips and tricks as to how you can protect your eyes from disease and injury. So firstly is to have a healthy diet and exercise. If you can reduce your risk of conditions such as diabetes, it can also slow down your risk of cataracts. Stop smoking if you are a smoker. Again, cataracts have been associated with cigarette smoking. And of course, ultraviolet light exposure is also a strong predictor of cataract formation. So if you're outdoors, do wear sunglasses, a hat, or carry an umbrella. If you do wear contact lenses, have a yearly checkup with your optometrist. Prevent any trauma to the eyes if you play contact sports. So certain protective eyewear or eyeglasses can help do that. And finally, if you're 60 years and above, do consider going for eye screening to pick up conditions like cataracts and glaucoma. You may want to start eye screening at an earlier age if you have other medical problems such as diabetes or a strong family history of glaucoma. So this comes to the end of the talk. Thank you very much for your attention, and I'll be happy to take some questions. Okay. Okay, so let me address some of the questions that have been raised. There's a contributor here that says that the eyesight in my left eye is slowly deteriorating. Should I continue with my current condition or seek surgery for the left eye? I think if you're not already seeing an eye doctor or seeing an eye care professional, do have a check just to make sure that it's not due to some other eye disease. If it truly is due to a cataract, then again, you'll have to consider, is it affecting your ability to work or to drive or to do your activities of your daily living? And if you do feel that it's affecting your lifestyle, then do consider cataract surgery. Another common question is for patients who've had cataract surgery before, and they'll ask, now that the vision is getting a bit blurry, has the cataract come back? Fortunately, the natural lens does not grow back, so it is unlikely that your cataract has returned. Okay, but one common reason why vision can be blurry after cataract surgery would be known as a posterior capsular opacity. Very simply put, sometimes you can get a bit of scarring behind the lens of the eye after cataract surgery, and this is a natural sort of response to having an implant in the body. Because the scarring is opaque, it blocks light entering the eye. Fortunately, this is very easily treated with a simple laser procedure that takes just 1 to 2 minutes. It can be done in the clinic as an outpatient procedure. So do get your eyes checked if you're finding new problems with your vision after cataract surgery. Is it still possible to have cataract surgery if I've had LASIK or other forms of corneal refractive surgery? Yes, definitely it is possible. It does not affect really the performance of the surgery, although it may affect the choice of the lens that you put into the eye. And you should speak to your eye surgeon to find out a little bit more when you feel it's time for the cataract surgery. So I mentioned that there are many reasons for cataracts. Most of the time it's due to age, but one of our contributors has asked, when can I go for cataract surgery for congenital cases? Congenital means that you're born with it or you develop it very soon after birth. And that's a very uncommon reason for cataracts. I think firstly is to ensure that the cataracts are not due to some underlying medical problem. Some babies and kids do have underlying medical issues that can also lead to cataract formation at such an early age. After that is to decide whether the cataract is causing problems with the vision, which is very much important for kids as they develop. If it is affecting their vision, it may lead to things like lazy eye or amblyopia, in which case cataract surgery definitely needs to be done at a much earlier age. If, however, it's not causing problems, but only causing issues when you're older as an adult, then the same considerations apply, whether it's affecting your work or your driving or your other activities of daily living and your lifestyle. I get asked quite commonly, does the cataract has to be very cloudy or very ripe before you have cataract surgery? I think this concept of a ripe cataract probably came about, in the 70s, 80s, and 90s when cataract surgery was still done manually. It was through a large incision, and the entire cataract was removed as a whole, and And in fact, having a dense cataract made the surgery much easier. However, with modern phacoemulsification cataract surgery, we would in fact advise patients not to do it when it's such a late stage. It does make surgery in fact much more difficult. So once it's affecting your driving, your work, and your lifestyle, I think it's time to consider cataract surgery. We spoke about putting an intraocular lens into the eye, and this is an artificial man-made lens to replace the cataract that you've removed, and the lens will actually last for the rest of your life. It's lifelong. So no worries about having an expiration date on the lens. Unfortunately, there are no eye drops that can remove cataracts at this point in time. So things like healthy diet and healthy lifestyle, sun protection, all these helps perhaps slow down the onset of cataracts, but none of them will prevent it or to remove the cataract. So I've been asked a little bit about the recovery after cataract surgery. Well, with most phacoemulsification cataract surgery, because the incision is so small and so tiny, you'll find that by the next day, vision actually starts to improve already. The incision heals over the next 2 to 4 weeks. So recovery time is actually relatively short. If you're asking about work, for example, if you're working at home or working in an office environment, then actually you can probably return back to work within a few days, perhaps a week or even 2 weeks. Do consider that you will need to put eye drops quite regularly for the first month. So you do need some time to recover from your cataract surgery. But overall, patients find that recovery is very quick after cataract surgery. There is a question, I need reading glasses. Should I seek surgery to correct my eyesight? Well, specifically for cataract surgery, I mean, if you have a cataract and it's affecting your vision, then do consider cataract surgery. But for patients that don't have a cataract, that their lens is still nice and clear, and their difficulty with reading is purely due to presbyopia or laohua, then cataract surgery would not be suitable. After all, there is a very small risk, even with modern cataract surgery. So there are other ways to treat presbyopia. Of course, the most common but the most disliked is reading glasses. There are certain forms of corneal refractive surgery, such as LASIK, that may help reduce the impact of laohua. But as my colleague previously mentioned, none of them will really get rid of your presbyopia or laohua. What is the probability or statistics of getting cataracts in Singapore? Oh, that's a very precise question. We do know that cataract formation comes with age, so I think it's inevitable that all of us will get it at a certain point. I think there's some numbers running around, you know, by the time you're 80, about 80% of us will get cataracts, 80 to 90%, right? But everyone is an individual, everyone's different, so everyone will develop it at their own time. There are questions about eye screening. I think at this point in time, you know, we used to do eye screening every year because of Eye Care Day, but you can have eye screening not just at ophthalmologists. You don't really need an eye doctor to do eye screening for you unless there are very specific concerns. But you can also approach your optometrist at the optical shop, and they can also do simple eye screening for you as well. There are a lot of questions outside of cataracts, so unfortunately I won't be able to address all of them here. But again, feel free to contact the National Eye Centre if you have specific concerns about your eyes. Our doctors will be more than happy to address them in person. Okay, so I think that's all the time I have for today. I'm glad to see so many people attending, and there were a lot of questions here. I'm sorry I can't address all of them, but feel free to contact us at the Eye Centre, and we hope to be able to help you in the future. Thank you very much and have a good Saturday.